Curse of insomnia. The answer is vitally important for your health. If you have any problems with sleep, grab a pen and paper because today you're going to learn why you have them and what you can do about it. Let's start out by bringing in sleep specialist Dr. Michael Bruce. Welcome to the show, Michael.
Thanks for having me.
So you very beautifully talk about two types of sleep problems: the sleep disorders and the disorders of sleep. Can you just sort of organize those, explain those for us?
Sure. So sleep disorders are formal criteria-based disorders, things like apnea, narcolepsy, restless legs, even insomnia. What I call disordered sleep is when somebody may get the quantity of sleep. They may be in bed for 7 or 8 hours, but they wake up and they don't feel so good, and they kind of wonder why.
And just to become pretty clear on this, because I get asked this question all the time, 15% of insomnia is a physical or neurological dysfunction, which means you got to see a doctor because you might need some medications. Remember, I said 15%, not 50, 1-5. Not many of us, but they're out there. For the other 85% of us, not being able to sleep is a wake-up call that it's lifestyle related, that you need to make some changes today.
Absolutely.
Just like depression and other types of anxiety. We're going to go through all these today, but the things that you can do. Now, Dr. Rose, I get asked two questions all the time. I mean, over and over again. Why can't I fall asleep? And then, even more surprising, why can't, when I wake up, I can get back to sleep?
Sure, there are lots of reasons why people may not be able to fall asleep, but one of the largest ones has to do with an overall level of anxiety. Most patients turn to me and they say, I can't turn my brain off when I get in bed at night. That's the big issue for me, being able to fall asleep.
Not in their heads. Right?
Yeah.
That's right. Yeah, me too.
Yeah. And then the staying asleep is also an interesting problem because sometimes people may wake up in the middle of the night and they may not be able to return to sleep, and it can really start some anxiety going.
So we've got a map. If you can put it up here. This is a study that was done using some CDC data that WebMD put out. And you notice that the least sleepy parts of the country are sort of on the West Coast.
Right.
And then the folks that are fairly sleepy, they're having problems with their sleep, are down here in the southeast part of the country. Why is it that we have geographic differences across the country?
Well, this was a very interesting study that was recently done by the CDC, and what they were looking at were several different lifestyle aspects. So one of them they found was sometimes in the southeast, things like levels of hypertension have increased down there, levels of obesity have increased down there
big difference.
From sedentary lifestyles and things like that. And so one of the big messages I think this tells us is, in order to sleep well, one of the things we want to really try to focus on is being active.
And just to underline the comment Dr. Bruce made, I think it's important for me personally, probably for many of you as well, you got to exercise. You have to do something physically active where your body doesn't feel a need to shut down.
Number one
and get back
thing.
to sleep.
You got to exercise.
Maria is just like millions of you. She hasn't had a decent night's sleep in years. Here's the question. Is her insomnia caused by a sleep disorder or disordered sleep? To find out, we sent her to the New York Sleep Institute. Take a look.
It's been about 5 years since I've had a decent night's sleep. This is one of the most frustrating things I've ever had to deal with. The first sign my sleep pattern was changing was when I'd start waking up in the middle of the night with a headache, and I started wearing a night guard because I was told I clench or grind my teeth. And once I started wearing that night guard, I couldn't sleep anymore. I usually go to bed between 10:30 and 11:30. I fall asleep pretty well. Then I wake up anywhere between 2 and 3. Sometimes I feel my heart race. Then I get scared. When I try to fall back asleep, I toss and turn. Some mornings I feel like someone beat me up in my sleep. I had one situation one time where I fell asleep at the wheel. That was one of the scariest days of my life. That was my wake-up call. I knew I had to do something.
We decided to admit Maria to the New York Sleep Institute to help her get to the root of her problem.
Please get ready for bed, and we'll hook you up and get ready to get the study going.
She was hooked up to the sensors so she could be monitored throughout the night.
Have a great night.
You too.
Technicians recorded when she fell asleep, what woke her up, and all the movements in her body and her brain. Will the state-of-the-art sleep lab diagnose Maria's problem and reveal a solution? The 3 secret reasons behind everyone's insomnia are tucked into these 3 beds. One bed has the answer for why Maria can't sleep based on her results in the sleep lab. How was your night at the lab, by the way?
It was okay.
Is it okay?
Not a restful night's sleep. I slept more than I thought I was going to sleep. They told me I slept 5 hours.
How much did you think you slept?
3.
3 hours. So you've all heard about caffeine. You've all heard about your diet. All these are common reasons that we interfere with our own sleep. So we're not going to talk about those. We're going to talk about the secret ones that you guys don't realize you got to. The first secret one, Dr. Bruce and I can do this together. The first secret reason is medications. It's the number one reason why people are unable to sleep normally. They're taking prescription medications, over-the-counter medications, and they can keep you awake. And that's not your problem.
No.
So talk to me a little bit about what it is.
So what's interesting about medications that we see, specifically with over-the-counter medications, is that many people don't realize what's inside a medication. So there are some analgesics out there with caffeine to help move the analgesic along. Also, some antidepressants can actually affect different stages of sleep.
And then, of course, as a solution, you take your medications in the morning if your doctor lets you.
Absolutely. Speak with your physician about maybe there's an alternative medication, or can you take that medication in the morning.
All right, now, let's go to the second bed. And the second reason why people suffer from insomnia, the second secret reason, is anxiety. And this sort of struck me because anxiety, the worries that keep you from sleeping, which is really sort of a wake-up call that you got to deal with it, has been reported by the National Sleep Foundation. And over again is one of the major reasons that we don't get to sleep. And there's a pie chart back here that foundation offered to us. And these are not surprises to you, because we know what we're all worried about these things. Notice, by the way, healthcare costs and healthcare concerns are two big chunks of this big pie, but relationships, finances, your job, all these come together to create an incredibly challenging environment for our brain, which has two modes of functioning, right? Awake and asleep. And when you're awake, you're processing information, you're working with it, trying to figure out what to do. Then you're supposed to be able to turn it off when you get to sleep. And that's a sacred art form. When that alarm system just can't settle down, then the brain perceives all those worries as threats that it's got to deal with now. It doesn't let you pull back and relax. So, Dr. Bruce, this must be, I would gather, the most common reason that you see people in your office.
Without question, this is the most common reason why I see people. And there's a lot of different things that can be done about it, everything from meditation and relaxation, but a quick, easy technique that I use personally for myself as well as with a lot of my patients.
Right. It's always a good sign when the doctor's doing it themselves. Did you find that? All right. Yeah. Now I'm listening.
Is I actually have people, I know this is going to sound a little crazy, count backwards from 300 by threes.
Why 3? Why not 7s?
Okay, well, you could probably do 7s, but 3s works better. It's pretty complicated math.
Yeah.
You can't think about anything else, and it's so doggone boring. Boom.
All right. Now let's look at the third reason, the third secret reason why people suffer from insomnia. And Maria, this happens to be your reason. You want to take a look?
Sure.
It is snoring. Snoring. Now, what I can't understand is how you would not know you were snoring.
I didn't know I was snoring, and I asked my husband if I snore, and he'd tell me very little, once in a while.
How long have you been married?
25 years this June.
Congratulations.
Thank you.
Maria's husband's over here, but I would think after 25 years you wouldn't be that polite about it. Did you notice her snoring at all?
Of course.
Of course. Now, I bring this up because I think a lot of us live in relationships where people love us dearly and they don't want to offend us. But take a listen to this. Bye-bye. Listen really carefully. This is footage from Maria's sleep study. And you might